Hi, I'm Commissioner Regalado. Thank you for joining us on your lunch break. Today, we're talking with one of our amazing community partners about the different programming and opportunities that we have and how we work with them and how we can work with you to do more and provide these services to all the residents of Miami-Dade County.
My name's Cathy Burgos. I'm a licensed clinical social worker, and I am also the director of the newly created Community Services Department. This is a merger of what used to be our Community Action Human Services and our Juvenile Services Department. Today, I am so excited to come to you and really deliver our continuum of care. And today we are going to focus on really working and supporting juveniles, at-risk children. And I'm happy to report that this work comes from national researchers, which is how our Juvenile Services Department was developed. But before I say a few words, and of course, it is my job today to really emphasize the importance of having the right staff in place. And today we have Elena Angulo, who's a licensed clinical social worker that will deliver this webinar. But before we get started, I've been a social worker in this community for more than 30 years. And when I see the work and the advocacy of Commissioner Regalado, I cannot stop being amazed. She is someone that's coming to the table and really rolling up her sleeves. And our department has always felt her support because we understand the work that she's doing and also her advocacy efforts when it comes to mental health services and delivering a continuum of care. So with that said, Elena, can we get started? Are you able to share the presentation? As Alejandro mentioned, this is a presentation that's focused on early intervention. We understand that prevention works. Second slide. Our mission statement. It's important to really emphasize on the importance of the way our department delivers services. So our Community Services Department delivers a comprehensive continuum of care that supports residents from birth to older adulthood, ensuring access to essential services that promote safety, stability, and emotional well-being at every stage of their lives. And today, we're excited to really bring in our continuum of care to all of you. We have programming from Head Start, early Head Start, to where Elena is going to be presenting today on serving effectively at-risk families, to running the Juvenile Assessment Center, as well as our new direction, substance abuse, older adults, running domestic violence locally. Our department, throughout every single division, we have licensed clinical social workers that are overseeing the importance of assessment and identifying the service needs within our population. Through the work that we're doing, we have our Community Services Department Training Center of Excellence, which allows us to utilize subject matter experts to bring information, as we're doing today through this webinar, to bring information to those who are working with the population or having to access services. So this is a part of our mission within our Training Center of Excellence. Now, I would like to introduce our fabulous presenter today. Elena Angulo comes to us as a trauma-focused cognitive behavioral therapist And she has the expertise not only in the therapeutic aspect of this work, but also in managing teams. She comes to us with a master's degree in social welfare from University of California in LA, and with 20 years of experience working with what we call dually involved children in the juvenile justice system as well as the child welfare system. She has been at the table with us, not only practitioners, but researchers, as we have established our national model within our juvenile division. She's also one of my top facilitators within our training center of excellence and has been involved in county-wide initiatives such as our mayor's Blue Ribbon Children's Commission. So she's coming to you with years of experience, with a lot of heart, with passion, and someone who is solution focused as we're serving the population to decrease recidivism rates locally in Miami-Dade County. I also want to emphasize on the fact that Elena is a part of a team, which I'm happy to report I am as well, that has been recognized as the national experts in the space of juveniles and keeping children out of the juvenile justice system. How is that, Elena?
Uh, Director Burgos, thank you so much for that kind introduction. It's very humbling and very honoring to be part of this team and to continue to elevate the work that we're doing with at-risk youth in our communities. With that being said, I want to start us off talking about the juvenile justice model. As Director Burgos mentioned, it is a national researchers did come and help us establish this model where we have now become a a point of reference, right? So for other models to work with at-risk youth and juvenile justice involved youth, not just nationally, but internationally as well. It really was an approach that we're utilizing so that the tools and the policies that we have in place are really addressing the youth across all levels. We pride ourselves in having master's level and licensed clinicians throughout all of our processes to ensure that all of our screening, all assessment, and our case management services are being delivered with the latest trauma-informed care so that our interventions are clinically sound. Additionally, so we collaborate with law enforcement agencies, with our Department of Juvenile Justice, and all of our local providers to ensure that we are having a streamlined approach in delivering our services. As you had mentioned earlier, the mayor's No Wrong Door initiative has been at the center of our service delivery to ensure that regardless of whatever point of entry we are touching our residents, we are ensuring that we are connecting them to services in a seamless and comprehensive manner. Okay, so I want to talk a little bit about what we do here, because a lot of times the community knows us, or we're best known as the JAC, the Juvenile Assessment Center. But we do a lot more than just process arrested youth. So with the national research model, we have a formalized or centralized processing facility for all arrested youth across Miami-Dade County. What that ensures is that all of the youth who do make contact with law enforcement, whether they're coming from Florida City or Miami Gardens, we have a formalized processing center here in downtown Miami to ensure that our youth are receiving the right services, the right processing in a centralized facility that's really targeted to youth. So when our youth come in, all of our staff are trained specifically to address this population. Once the youth come into the Juvenile Assessment Center, they are immediately receiving evidence-based assessment interventions. And what does that mean? That means that the tools that we're using have been researched and have been proven effective to address the root causes to the specific population that we're working with. Based on those assessment tools that we're using, we're able to make educated recommendations or informed recommendations to the state attorney's office. And this is really important because juveniles in the state of Florida have multiple diversion programs that they can qualify for based on the reasons why they're coming into our facility and based on our assessment results. So it's imperative that our case managers or our juvenile assessment counselors, once the youth come in, we are providing those assessment tools so that we can make the best informed decision to our state attorney's office to give those youth the opportunity that otherwise they may not necessarily have. And an example of the programs that we have or that the youth can qualify for are our prevention program. I'll talk a little bit more about that later on in the presentation. Our pre-arrest delinquency citation program, and the youth that qualify for that program are youth who have for nonviolent misdemeanor offenses. This is really important because a youth who participates in the pre-arrest delinquency citation program, if completed successfully, they can legally say that they have never been arrested. And that has been a revolutionary in the juvenile justice field because this is giving those youth an opportunity to receive services, so to address the reason why they came in contact with law enforcement without having the long-lasting effects of having that quote-unquote mistake or wrong choice follow them throughout their adult lives. We also offer two other diversion programs, which is the Juvenile Delinquency Alternative Program and Juvenile Alternative Sanction Services Program. So our JDAP and JAS programs are diversion programs for youth who qualify for these two services. And the diversion is diverting them from formal probation. So our department is a county department where we run and administer all of the prevention and diversion programs for youth who have these opportunities and don't have to penetrate the formal juvenile probation system. And then lastly, we participate in our outreach efforts throughout Miami-Dade County because it's really important for us to share all of the services that we are providing with the community as a whole. So part of the Juvenile Assessment Center, part of why our department is so important, our unit is so important, is because we are collecting data on all arrested youth in Miami-Dade County. And this helps us determine where the service needs are and what trends we're seeing. So in the past 10 years, with these diversion and prevention programs in place, we have seen a 60% decrease in juvenile arrests. And that's a significant decrease when we're talking about the juvenile population. It's really important for us to tackle those front end services. So meeting those kids at the beginning when they're showing some type of at-risk behavior to deter them from ever penetrating the juvenile justice system. Our department, since inception, has collected data on over 200,000 arrested juveniles and arrested and at-risk juveniles. And again, this allows us to provide the information to our community to further research and strengthen the interventions that are focused for at-risk youth.
Elena, before you move on this slide, and I'm so excited with the fact that this slide was included, I would like to just share with the group that when you're looking at this data, it's important to really understand that everything that we're doing at the Juvenile Assessment Center, as well as in the programming that Elena is running, it's a data-driven approach. And as you're looking at the data, I want to remind the group of something that was stated at the beginning of this presentation. This entire process was set by our criminal justice partners, as well as different practitioners and researchers coming together and really understanding the research, really understanding the evidence-based assessment tools for the population. And Elena, I'm sure we'll go into some of these tools that we're currently using, but for me, it was important to underscore that this is a research-based model that's using data to understand the trends when it comes to the juvenile population. We are a public safety department. We understand that if at the front end, as Elena mentioned, we're able to identify the service needs and link to services early on, there's less of a cost to this community. We understand that prevention has to come first, but doing it in a way where you have qualified folks working with the population, delivering the assessments, and what we call wraparound services for you to have sustainable change, right? For our families to be self-sufficient. So that's an important piece for me to underscore.
Yeah, thank you, Director, for that. Okay, so as the director mentioned, part of this data-driven approach is using these evidence-based assessment tools that help us identify the specific needs of the youth that we're working with. The first tool that we utilize is the Global Assessment of Individual Needs, which is the GAIN-Q. And this assessment tool helps us identify mental health, family, and substance abuse needs across the youth that we service. This tool is very imperative because it gives us an insight as to what's going on in that individual youth's life and what their specific needs are. All of our programs and all of our interventions are tailored to the specific needs of the individual child. And this has been proven to be one of the most beneficial ways to reduce that juvenile recidivism or to reduce further involvement with criminal behavior is by targeting it and tailoring the specific interventions to the youth, the needs of that youth and their family. The next tool that we use is the Youth Level of Services instrument, the YLS, and this is a tool that helps us predict recidivism. And for us, recidivism means that the youth will commit a crime or re-engage with with the criminal justice system. So when we're targeting this, when we're administering this tool, we're really evaluating the risks and the barriers that each youth have. So one youth can be a low risk to recidivate, and that would include that they may have a lot of protective factors, that they're engaged in after school activities. They just made a mistake, but they have that support system in place to help them prevent from repeating that. Whereas a youth who is a high risk to reoffend, they may lack a lot of those things. And that's where we come in to help reinforce and provide that wraparound approach to help those youth stay out of the juvenile system. That next we administer the Adverse Childhood Experiences screening tool, and this tool has been nationally recognized because what this tool identifies is adverse experiences, so traumatic events in childhood, anything from exposure to domestic violence, to neighborhood violence, to mental health or substance use in the home. And this tool really helps us identify, again, what the risk is in the future. So the higher the adverse childhood experiences that a person experiences, the more likely they are to experience negative outcomes in the and their adult lives, and not just behavioral outcomes, but this tool was actually designed in the medical capacity. So the research shows that the higher number of ACEs one experiences in childhood, the higher their likelihood to experience medical and health problems as adults. So we're screening these youth again at an early point to help mitigate those factors for later on in life. We have age and gender specific assessments because we know that, males and females have different needs, that a 11-year-old and a 17-year-old are going to have different needs. So our assessment tools are age and gender specific so that to ensure that we are capturing the best information possible once we're screening our youth. We also have what's called the young offenders process. So unfortunately, we do have a population that's under the age of 12 who do come in contact with law enforcement for multiple reasons. And we know that the research has shown us and has informed us that the younger that a youth comes in contact with law enforcement, the higher their chances are to penetrate the adult justice system. So we really take a special protocol for these youth who are under the age of 12, where we are providing a multidisciplinary team approach to ensure that we are, collectively working and as a team with all of our other sister departments to ensure the best outcomes possible for these youth. Again, we work closely with the state attorney's office, and many times we will advocate for what we call prevention in lieu of an arrest. That means that we are completely diverting the youth from the juvenile justice system and putting them into our prevention program, because we know that a 9, 10, 11-year-old, whatever is leading them, whatever behavior has led them to come in contact with law enforcement is not something that will be corrected necessarily by, processing them formally in the juvenile justice system. So these are the approaches that we take across all of the programs of the youth that we service in our programming. And so again, going back to this data-driven approach, because we are administering these evidence-based assessment tools, we are able to collect and gather trends and data from the assessment tools. So you can see here over the last 2 years what we're seeing in our clientele and our clients. So we're looking at mental health, at substance use, and family issues. And this is all self-reported and family reported from these instruments that we administer. So we're seeing that between 26 to 28% of the youth that we service are experiencing some type of mental health needs. We're seeing that between 31 and 36% of the youth that we see are experiencing some type of substance use need, and between 25 and 29% of the youth that we see are experiencing family needs. And these elevations for us are really important because what we do in our programming is that we're addressing these specific needs. So we're connecting all of our clients to community-based organizations that are going to address the specific needs that we have identified in our assessment process to ensure that the clients' services are being met, or their needs are being met through the services in the community, and that again we're putting in those protective factors to help mitigate and reduce their risk for reinvolvement in further criminogenic behavior. And then the second table here is our risk level. That was the tool that I talked about that will measure the risk to reoffend. So we're seeing that between 69 and 78% of the youth that we service in our diversion and prevention programs are of low risk. They're between 69 to 78% low risk, so that they are low risk to reoffend. And this is really important because, again, these are youth who have committed a minor crime, a minor offense, and with the right services in place, they won't have contact with law enforcement or further contact with law enforcement later on in life. We see that the other side, between 31 and 22% of the population, are between moderate and high. And what these kids, when we service them, we are connecting them to what we call our higher level of care services. These are youth who are going to be monitored at a higher level. They will be connected to services in the community that may be a little bit more intense in terms of service delivery, just because we know that they have higher risk factors. So we're really going to provide, again, that wraparound approach to help mitigate those outcomes. Okay, then we have our prevention program, and this is something that I think it's really important for the community to learn about, because all of the other programs that I have just mentioned are what we do when youth have had that interaction with law enforcement. So those are programs that once youth have made that mistake or made that contact with law enforcement, this is what they're eligible for. However, the prevention program is a program that the community at large can take advantage of. Many times we would have people or parents call us and ask, does my child have to be arrested in order for us to receive these services? And the answer to that is absolutely not. Our prevention program was specifically designed to ensure that we are providing services at the front end without having to wait for kids to have contact with law enforcement. So our prevention program, as I mentioned, is open to the community at large for any youth who's displaying any type of at-risk behaviors. This can be anything from, substance use to experimentation, poor academics, school attendance, disciplinary problems, the onset of mental health issues, or if a child or a teen is just not they don't have those pro-social activities. They're in need of mentoring. They're in need of job development. So these are all the people or the youth in our community that can benefit from the prevention program. Our focus is on those early identification of service needs. As I mentioned before, we create individualized treatment plans for each youth that we service, and we make referrals out to the community based on those needs that have been identified. We provide case management services. So through all of our programs, we have assigned case managers to each youth and a family who monitors them, who follows up with them anywhere from 3 to 6 months to ensure that everything's going well. We're doing school visits, we're doing home visits, and we're also having contact with our community-based organizations to ensure that the service delivery is being effective for the family. And if it's not, if at any point the youth or the family are needing something different, that's where our case managers come in and will adjust our program plan to meet the specific needs of the family. You'll see here in this picture a group of youth with our fire department. It's very important for us to ensure that we are increasing that social capital, right? So creating those opportunities for our youth to explore different career options, different career paths that they may not necessarily be exposed to otherwise. So we have group mentoring where we take them to different county departments. We partner with different organizations and corporations to give these youth that exposure that they need to different career opportunities. Again, this is another example in this picture. We took the youth to the port, again, exposing them to different opportunities in that group mentoring effort to just kind of brighten, expand their horizons, getting them to think outside of, the possibilities that they may or may not know that they have. So the benefits of our prevention program, again, it's that early intervention. So we take, kids as young as 6 or 7 years old, because research has shown us, right, that the earlier we intervene, the better the outcomes are. So that early intervention is key, those front end services. We're preventing youth from entering the juvenile justice system through a systemic and efficient approach. We accept referrals from anyone. So a police officer, from the state attorney's office, from schools, from parents, from any concerned adults. We accept referrals from anybody. It is a voluntary program, meaning that we don't have access to the court systems. So if at any time a youth or a parent doesn't want to participate voluntarily, unfortunately, we don't have the methods to legally enforce participation. However, our case managers are very well versed at working with the population. So many times we are able to get the youth to agree to participate in services. We administer the same evidence-based assessments in our prevention program as those youth to the ones that the youth in the diversions programs receive. So really it's not a watered down approach or anything. It's the same caliber of services that our prevention program participants are receiving as those of our diversion youth. So these are some of the trends that we see in our prevention program. We're seeing 64% males, 36% females. Our population is comprised of 23% African Americans and 28% Latinos. Here in our elevations that we're seeing in our prevention population, we're seeing that 32% of our participants elevate in mental health needs, 23% elevate in family issues, and 25% in substance abuse. And again, with these elevations, what we're doing is that we're targeting these specific needs and connecting our youth and our families to providers that will help address those services. We've seen more than 2,500 children in our prevention program. So again, these are children who have had that opportunity to receive services prior to engaging with law enforcement. And our top referrals are the schools. So we have a very strong collaboration with Miami-Dade County Public Schools, where their school counselors receive a training and information on our prevention program. Our parents are calling us, law enforcement, state attorney's office, and with our partners with the anti-violence group are Walking One Stop. So we receive referrals from them as well. And again, as I mentioned, we partner with our community-based organizations. So we make referrals to organizations that provide services in areas such as anger management, disruptive behavior, family issues, drug experimentation, and negative peer association. Just to name a few or some examples of the services that we connect to. We have a network of private and public community organizations, as well as faith-based. The referrals really are based on the service need and the family's preference. So that's how we connect our clients to services. And for any of you that are interested in making a referral to our prevention program, this is the contact information. You can scan the QR code. We do have a online referral application, and we'll connect with you once we receive the information.
Wow, Elena, wonderful job. I love the fact that you were able to give the continuum, right? A family-focused approach to serving the population. Elena, I do see two questions that I would love for you and I to address. If I can address the last one, the one that's coming in from Jacqueline Figueroa. And then if you can address Miguel Mendez question, that would be fantastic. Yes. So Jacqueline Figueroa asked, do you have any data on at-risk juveniles and undiagnosed disability? Does your assessment include educational assessment? So Jacqueline, as Elena just mentioned, we do have a really strong partnership with the school system. The school system has identified a liaison for us on the juvenile side that allows us to go into the records the school records of the child, and to also find out if there are any types of plans in place to address either a disability or a child who may be acting out. So although our staff do have the opportunity to flag within our Quest case management system whether there is any disabilities that exist, it's important to really express the fact that we rely on the school system's official records to really address the needs of children. And in line with your question, Jacqueline, as well as the partnership with our school system, Elena, along with other licensed clinicians, have established, and she spoke a little bit about the young offenders population, which is addressing the needs of children 12 years and younger with at-risk behaviors, right? We understand that according to the literature, having contact with law enforcement before the age of 12 is your highest predictor of a child becoming a chronic offender. And because of that, Elena, along with some of our licensed clinicians, have established multidisciplinary staffings that also includes representatives from the school system so we can address their official diagnoses. I don't know if you want to add to that, Elena?
Yeah, so thank you, Director, for that. And to add, so we are not diagnosing. All of our assessment tools are screening/assessment tools. But for those youth that we suspect that have any type of learning disability, we are strong advocates with the school system so that they can get the formal assessment. So we will help the parents navigate and request the IEP process. So we are not conducting those assessments ourselves, but again, we are strong advocates and help the parents navigate that process. And then, so the next question I have from Mr. Miguel Mendez from Second Chance Youth Outreach. So the question is, if we help juveniles when they are coming from juvenile jail. So we are the processing center for all arrested juveniles. In our facility, we are they're housed here for maybe up to 6 hours, right? And depending on what program they qualify for, they will either go to the detention center, they'll be released to an adult, or they'll be sent home on what we call GPS, electronic monitoring. So once they are assessed here, whatever service need has been identified, we will make connection and make referrals to the aftercare services. So whether it be to one of our diversion programs, we're responsible for the aftercare. If the youth is being transported to the juvenile detention center, we will have made flag those alerts so that they can receive those services in that setting. Or if a youth is being released into the community, we will make the referrals or have made that referral to the community partner for further follow-up.
Elena, and if I can add a little bit to that, Miguel, I think that it's also important to share with you that our community has been so innovative on the front end that many of the kids that may be picked up by law enforcement due to a misdemeanor or a non-violent felony, they're referred to us at the front end. Our state attorney, Cathy Fernandez-Rundle, has been a champion in children being seen at the front end. And of course, we've had the advocacy of our public defender, Carlos Martinez, and so many of our juvenile justice partners that instead of children having to go to court, going to juvenile detention, and then being diverted, right? This group, as a community, we've been able to keep children out of the system and really implement those services at the front end. We understand also through the literature, right? The deeper a child goes into a system, right? Then they may become, right, a chronic offender or just repeat the offense. So for us as a community, it also includes judges like Judge Orlando Prescott, individuals that have worked hard in keeping children out of the juvenile justice system, including our schools, superintendent, and just so many of our partners, Children's Trust, and so many key folks that really want to set up the safeguards so children do not have to enter the juvenile justice system. I also want to share that our sheriff has been key in really implementing things like civil citation to ensure that children are seen at the front end. Elena also mentioned at the beginning of the presentation, our mayor, through a no wrong door approach, has really established, including this merger, has really established departments, processes that can leverage resources and really connect families in need to those services to ensure that we're having the results, right, that's needed when families are going through some of these challenges. And Alejandra, I believe those are the two questions that we see in the Q&A.
Fantastic. Well, thank you so much for this educational webinar and joining us, the newly created Community Services Department. Cathy, thanks so much for your leadership. Elena, thank you so much for the breakdown. As I mentioned before, I will share the link. I will share the link once the video is ready for everybody. I'll send the email to all those who registered, and including any other information that maybe Cathy and team want to share. Yeah, keep an eye out for more educational webinars moving forward.
Thank you so much, Alejandra, and thank you for your advocacy and support.
Thank you. Thank you.
Thank
Take
you.
care.